I'm here for book club. So many of the people who benefited from the Affordable Care Act were also the ones who were strongly against it. That shows how much perception and misinformation shape opinions. A lot of the opposition came from people who thought the ACA was too much government control and a threat to their freedoms, which shows how important it is to explain policies clearly so people can make good decisions. This paradox says a lot about the power of perception and misinformation, and the gap between policy intent and public understanding. Many of these individuals were influenced by narratives that cast the ACA as government overreach or a threat to their personal freedom. This disconnect highlights the importance of health literacy in America and effective communication when introducing major policies. The lack of health literacy in America causes people to believe falsehoods like death panels, which became a rallying cry for the ACA critics despite being totally baseless. This kind of messaging happens when people are not equipped with the tools to evaluate claims critically. It shapes the understanding of and acceptance of policies like the ACA, which are often presented in ways that make them feel complex to those who lack experience with the healthcare system. Without clear explanations, people will not see how the policy benefits them, or worse, fall victim to the conspiracy theory rabbit hole. I think it's worth mentioning that health policies generally have a connection to personal and cultural values. Discussions about access to care, government programs, can get people riled up. People want independence, community, and fairness, and if a policy feels wrong, even the people who benefit from it are likely to reject it. Public health educators and policymakers have a responsibility to inform the public in ways that are accessible and relatable, explaining how it affects people's lives rather than what the policy does, right? If we break it down into simple terms that communities can connect with and use trusted voices of local leaders from community groups to share the information and be proactive in addressing misinformation and offering evidence based responses. Policymakers should be transparent about how they're making decisions. If people feel excluded from the process or suspect hidden agendas, even a well-designed policy will struggle to gain acceptance. Showing the human side of a policy through stories, testimonials, and community input goes a long way in building support. The messenger can be just as important as the message, and people are more likely to believe information from those they perceive as credible. Skepticism of government is real, and for a good reason, and we can't ignore it. So we need humility and authenticity from leaders and to listen to concerns and acknowledge their failures. It goes back to the idea of health equity as both a process and an outcome, a journey and a destination. Equity is not a one time effort, it is a process that asks people to confront inequity and challenge the status quo, but work through compromises. Some disruption is necessary, but people don't like it because it threatens their familiar ways. It reminds us that advancing health equity takes patience and staying committed to the process, even though we're a long ways away from our goals. Thanks.